So I think what gives me the energy to do my job, which includes days and nights and weekends, is really I'm inspired by the collaboration and the passion of the team that I work with. So looking at the teamwork around me day in and day out and seeing how dedicated our entire team of RNs and RTs, the pharmacists, child life specialists, and even our PT and OT colleagues really inspires me to keep doing what I do.
Our nurses here at Oklahoma Children's Hospital have an extensive onboarding process, and for the PICU we have a lengthy orientation to make sure that everybody feels comfortable assuming the care of critically ill children when they come off orientation. We have further training for ECMO and for continuous dialysis that our nurses will then go through to care for the most acute patients in the state of Oklahoma.
We have really good collaborative care with the respiratory therapist, our physician team. We do have certified nursing assistants now. So I think we just speak really well to each other about things. Like if there's a patient that maybe we're having issues with the ventilator, we just call the RT, call them over, and then we can just talk about like, hey, with the physician, what do you think would be good? So I do feel like we're heard, or they are heard in that aspect, and we just work really well together. Like I said, we all just feel like one big family.
The kids that we see in the PICU at Oklahoma Children's are from all ages. We can get anywhere from newborn if you go home, and then come back, but sometimes they're like less than 24 hours old, all the way up to, I've had a 40-year-old patient. A lot of our chronic kids we continue to see throughout their diagnosis, especially if they're cardiac children, as well as hemonkers and things like that. And so a typical day with these patients would look like anywhere from viral. We see a whole bunch of young viral children in the sickest months of the winter. As to traumas, we are a level 1 trauma center here, as well as complex chronic kiddos. So we truly see everything.
So PICU nurses have the opportunity to pursue a lot of specialty training. We are certified in ECMO if you choose to be. So that's a week-long class that our nurses can go through to become ECMO techs. We also certify our nurses to run bedside dialysis. We utilize CRRT. We typically like to have about a year of experience at bedside to do that. And then there's a lot of other specialty training that you can go through. For example, PICU Up is something that we're really working on right now, and it's about early mobility of intubated and chronically ill patients. So once someone identifies their likes and dislikes, they can really seek out educational opportunities that fall in line with that.
Every nurse, whether they're a new graduate or an experienced nurse, will have unique learning needs. So I meet with everyone individually to identify what their learning style is and how they receive feedback. That helps me pair them with an experienced preceptor who will work well with them and give them the best orientation to the unit. I also check in frequently with them to make sure that they have everything that they need, and if there's an issue, I work with the leadership team to identify a solution so we can maximize their time on orientation and make them well prepared to come off of orientation and start serving the unit. One thing that is a great opportunity for nurses who are looking to make the move to Oklahoma Children's is our pay scale. We recently significantly increased the pay for not only experienced nurses but also new grads to make it so we are a leading pay structure here in the state of Oklahoma. You won't find better pay anywhere else.
So I'm originally from the Northeast, so I think moving to Oklahoma was a big move for me, and I didn't know what to expect, but I absolutely love Oklahoma City. It just has everything to offer, and it's such a fun place to live. I think the food here is surprisingly fantastic. I have tried probably at least 100 restaurants in the city and still have more on my list. I also really like being outdoors and hiking, which I think people from outside of Oklahoma maybe don't see that as a huge drawing point to here, but there are really excellent places to go, get outside, hike, go to lakes, things like that, very close to Oklahoma City.